Hello, my name is Josh Golomb, and I'm the CEO of Hazel Health. And I'm here with Superintendent Rubin Reyes of Robla Elementary School District. And we're excited to share our presentation, which is meeting the needs of pediatric patients in grades K-12 with telehealth. And so just by a quick background, Hazel Health, we do school-based telehealth. We operate in schools representing almost 2 million kids across the country, across 12 states, bringing both physical and mental health services to kids. It is my absolute pleasure to introduce Superintendent Reyes, who has been doing amazing work in his community and have been a phenomenal partner for Hazel. Superintendent Reyes, I'll turn it to you.
Josh, thanks so much. So welcome everyone. Thank you for having me today. I would just like to share that I am the superintendent in the Robla Elementary School District, which is a small school district in the city of Sacramento. I've been in my school district for over 20 years. I started here as a teacher and I'm just beginning my 12th year as the superintendent here in the school district. I think what I'll talk about today is, of course, the context of telemedicine in a community such as this. But I think really what we're going to talk about today is this idea that more and more, especially in certain communities, schools are expected to provide a wider array of services, not just because don't think we don't have enough to do and we're looking for other things to get involved in. It's really just become a necessity, and so becoming involved in things like health access for our families has really just been dictated by the needs of our community. So again, Robla is a small elementary district in the city of Sacramento. We serve a little over 2,000 students in preschool through grade 6. We have 5 elementary schools, a district preschool center, and then we also have a brand new charter school that serves grades 7 and 8. We're in the city of Sacramento, as I've said. We're about 10 square miles on the northernmost edge. And while I have lived in Sacramento my whole life, I was unaware of this particular community, which unfortunately is characterized by a very high degree of poverty. And interestingly, coupled with that is the idea that there aren't a lot of services available in this part of the city. So we're characterized by neighborhoods, some that look very suburban. We've also got some big plots of land for people who have livestock, those kinds of things. We have a lot of warehouses, and that's kind of how the land is used. Unfortunately, we don't have any kind of hospitals or clinics, and frankly, we don't even have a very good grocery store. There's lots of fast food places, gas stations, things like that. But in terms of access, this community has some real issues around being able to get the kinds of services that families may need, especially if you're a family that is living in poverty. So if you need to get to a clinic or to a hospital, you do have to find a way to get transported there. And if you're having difficulty paying the rent, sometimes you don't have a car. The bus system in Sacramento doesn't really serve this part of the city very well. So we, for example, have to do a great deal of busing in order to get our students to school, because transportation is a big issue for a lot of our families. I think the other thing that interestingly has come along, part of this work, is learning that we have a lot of families who are homeless, which is, I think, just yet another rung down from living in poverty, this idea that your housing is unstable. And while it may not be that you're living on the streets, it may be that you're doubled up with another family. The problem is that you are forced then to have to deal with quick changes in your residency or where your kids go to school. So there's just a great deal of turnover. So all of these things get in the way of learning. And that's why here in Robla, we decided we need to become involved in helping students and their families access some of the services that they need. Why don't we go to the next slide, Josh? We've talked really about this piece. I think one of the things that I want to mention here is the fact that language access or the ability to speak English is an issue that faces a lot of our families and something that we have to always pay a great deal of attention to. So putting all of this together, how did Robla get involved in becoming part of providing the service of telemedicine? And I will say, as I have, that what happened before was if a student had a health issue, then what would happen is we would contact the family and we'd say, it looks like little Jose needs to be checked out by his doctor. And we would call the family and say, please come and pick him up. And then they would go away. And honestly, we would just cross our fingers and hope that the family would be able to follow through. And sometimes they were able to, and sometimes they were not. If they didn't have good access to medicine, then oftentimes what we simply had was Jose missing a lot of school. And then he came back in the same situation he was in when he left. So we could sit back and just lament this situation, or we could become involved in helping this to get better. And it was around this time, and we began to search for how we could partner to do this, because a school district, of course, is not equipped to provide health services in that way. We did have a school nurse, but she obviously could be stretched only so far. And we were introduced to Hazel and found a great partner in this organization that seemed like they could provide us services that was really, really important to our families. We didn't have the funding to do this initially, and we had to really begin to think about how we could be creative and figure out ways to provide this, this kind of service. I want to say something else about the partnership. I just think it's really important for us to remember that partnerships mean everybody kind of has to do their part. And I think that it's important for a school district to be able to find partners that understand how school systems work and the needs of our families. I think that it's very interesting that our school nurse, I think this is something that is an interesting anecdote in this work, is that our school nurse initially was very reluctant to get involved. She almost saw that this might have been a way to get her out of a job. And of course, what we were trying to do was support her. And it's funny that during the course of this work, she went from someone who was very leery to someone who has become very much an advocate for programs such as this, because now she has people who are knowledgeable about the needs of students and their health and who can support us and support them in moving forward. So the partnership began, and we'll give you more details around how it's worked, but it's been an exciting and extremely impactful service that over the last number of years now has made a great deal in the lives of our families.
Yeah, well, and Superintendent Reyes, I wanted to follow up before we get into partnership. And so, you know, for most of the folks who are listening in have a healthcare background, and the educate. Well, a lot of us, including me, have kids. Have gone through the education system. My wife's a teacher. I don't think everyone always really appreciates what it's like to be a superintendent, to meet the needs of students, and as an educator. And in the healthcare world, there's this term that is used a lot now. It's called social determinants of health. And we talk a lot about the healthcare side, that it's not just providing care, but things like food and shelter and a lot of the things you touched on. But all those things play out in Robla, in schools across the country. And I'd love to get just your thought. How do you think about your role as a superintendent, given there's so much more you're doing beyond just educating our kids?
Well, that's a really important point, Josh. I think that those of us who are involved in education, first and foremost, became educators because we want children to learn, and we want to do that in the most effective way possible. I think my story is very much tied to why I do the work that I do, which is that I am the first person in my family to have gone to college. And I enjoy a life now that has a lot of wonderful things, that has everything to do with what became accessible to me when I got an education. So that's why I became an educator, because I feel very strongly that education can really kind of break that cycle of poverty that so many of our children live in. But quickly we found out that there's so many things that can get in the way of that education. And that's why, as you say, Josh, suddenly I found myself needing to be so much more than an educator. We needed to kind of figure out ways to help families who live in poverty get past these things that were getting in the way of learning. So health is one area, absolutely. But we also have become involved in food distribution. We serve 3 meals to our students a day, which was something that began about 5 years ago. We were already serving 2, but we found out that we needed to provide yet a 3rd meal at school. We found out that a lot of our families did not simply have access to food, both for financial reasons, but also geographically. So we have partnered with other organizations to provide food access. So we do food giveaways in a variety of ways, some really innovative ways that we're able to do that. We partner with other organizations around a variety of other things. One I'll spell out just really quickly. We have a college savings program we called Kindergarten to College. And in a partnership with our local United Way, we actually started a college savings account for all of our kindergarten students, which it's not a lot of money, but I will say it really just starts the conversation around college, which for many of us with our children, we understand the importance of having that conversation even at a young age. But if you're in a family where college has never been an option for anyone, you don't think of having that conversation. And by giving them this funding, we are able to not only get them thinking about saving for college, but also getting them thinking about this as an opportunity for their children as well. So, I didn't become an educator to do any of these things, but it's the world we live in, and it's what our families need.
And I have to say, I've been able to see Superintendent Reyes both at school board meetings, essentially a CEO of a relatively large organization, and also at community meetings, and the connection he has to families and the respect they have for them. So just thank you for everything you do for our community. So I'll give just sort of the quick view of what Hazel does. And I should stress, when we started Hazel, Robla was one of our very first school district partners. So a lot of things that where we are today, I mentioned us working with schools representing about 2 million kids. Back when we were in the thousands, it was the partnership with Superintendent Reyes and the Robla community that helped shape this. But what we do is our goal is to make sure that we can serve the needs of kids, needs of young people, K-12 in schools, whether that's mental health, physical health, this integrated care approach, wherever kids are. Our main focal point is being at schools, but we're also able to offer services at home, which has helped particularly during the pandemic. And then the way that it works, if you imagine at the school setting, we set up sort of think of it as a kiosk. There's both the iPad, you can actually see Nurse Judy from Robla right there on screen with one of the Robla students, and then a whole set of peripheral equipment. So there's a setup, but then a large part of the work is also making sure that we can integrate with all the data systems, but more importantly with the community processes and all the things of how the school community works, from everything from how Superintendent Reyes gets the message out about new programs to their families, to making sure that Nurse Judy, that it fits her actual workflow at the school site. And on the home site, it looks very similar to what you'd imagine telehealth at home to be, with the main difference being that we can actually connect back into what's happening at school. So a child that we may have seen during the day, there could be a follow-up if needed at home in the evening. And so Superintendent Reyes and I will now talk a bit about the partnership. And you shared a little bit about the Nurse Judy skepticism, but I'm curious, Superintendent Reyes, to share a little bit about what you heard from your school board, the broader community, kind of in that first set of stages.
It's funny how now, a few years down the line, this has become such a part of how we do business in the Robla School District. But as I think back, I think about that initial reluctance, because this was something that was so out of the box for so many people. Yes, for our school board. Yes, for our families. Nobody seemed to why would I sign up for medical things at school? There was a lot of reluctance on the family's part, just because it was something they had never heard of, and they couldn't believe, because we were able to secure that funding, that we would be able to provide this service to them, it seemed like it was almost too good to be true. So I think there is kind of some learning that needs to happen. And of course, the way that this catches on is really the success that breeds more success, and families telling other families that, oh my gosh, I sent Jose to school today, and they called and they said he had a fever. And, in the past, what I needed to do was talk to my boss and leave work and go get him and then figure out if he needed to go to the doctor. And now the program gave him some medicine and he went back to class, and I didn't miss work and he didn't miss school. And it was something that people were in awe of from the beginning, and then it just kind of picked up speed from there. So that idea that it's such an innovative thing when it seems like such a simple concept, I think is something that you have to kind of work on. I think you mentioned this, Josh, this idea that, you got to really kind of figure out how to market this and really talk to families about how this can be of not only benefit to their child, but a benefit to them as well.
Right, and I'm going to skip the peak because we'll share some of the data in a slide, but let's talk about the last year and a half with the pandemic. And so when you think about that for the Robla community, kind of how kind of health and public health became even more front and center for you, what was that experience?
Well, COVID brought so many challenges, I think, to all of us, to us as educators and to our families. Every layer of support that we could provide was such an important part of the business that we were doing with our families. So being able to shift quickly, and the partnership with Hazel allowed us to work flexibly together to shift to Hazel at home, which allowed families to gain access, whereas before, they had to gain that access at the school through the school nurse. They now had access to that at home. And again, during this time of quarantining, when families we were all kind of holed up in our homes, that they could have access to telemedicine was really, really important. That worked really well for our community because of the high level of poverty. We were able to give every child a computer. So we've solved the equity issue. It wasn't, well, you can only access Hazel Health if you have a computer. Well, we gave every child a computer. So now everybody had that access as well. And, Josh, you'll share the numbers. I'm sure, we didn't get a lot of response to it because I think there was just, we were all trying to navigate through the healthcare system during COVID. And if you don't speak English, that's just got another layer of difficulty. But knowing that it was there, I think is something that we've heard very much from our families. If they needed it, then they could access it. So I think just that idea that we can provide as a school district multiple layers of support. This was just another resource in our arsenal to do that.
Great. And for the moment, I'm going to skip over the mental health and come back at the end because I want to share some of the data. And so one of the things that we had the ability to do is there's a part of the U.S. Department of Education, actually, there's a group that they fund called the Institute of Education Studies that they actually did a bunch of research on the actual partnership that happened between 2017 and 2019. We looked at a bunch of metrics. One of the things I'm going to pull up right here is actual utilization. And this is a frame for those of you who remember pre-COVID, the typical engagement of telehealth, if you look at a lot of the major providers, was often in the 4 to 6% range. And what we were finding by being open within schools is that our engagement rate was well over 20%, and in some populations as high as 40%. And I will actually say, in Robla, we weren't able to be open every single day for a few reasons. And so this is actually slightly lower than a few of our other districts, but was phenomenal. And one of the things we're particularly proud of is a lot of the data, both pre and post-COVID, that while even within that telehealth engagement, there's often big discrepancies in health equity, and that low-income communities of color are less likely to be able to access this. And by being in schools and a lot of the outreach we did with Superintendent Reyes' team, that not only was there high engagement, but actually our highest engagement rate was with their Black families and students. And you can see the data here. We are really proud of the fact that not only are we increasing access, but actually directly addressing health equity. I'll flip to the next slide. And so here's in addition to that, some of the data points that came out of there, along with follow-up surveys we've been doing with families. So number one, one of the first metrics we looked at is when we see a child together with the Robla team, can we get that child back to class as opposed to having to lose instructional time, parent having to leave work. And we found that actually 94% of the time, kids were able to return safely back to class. And so that was from the study itself. Then from the parent surveys, we asked them to estimate every time there's a Hazel visit, what does it mean for them? What's the impact? The NPS score, the Net Promoter Score, has been off the charts, at 95. But they tell us that about 3 hours of, 3 hours of saved classroom time for getting back to class. So that's the student side, 3 hours more of classroom time. And the parent side has been, they estimate that every Hazel visit means roughly 3 hours of work that they didn't have to miss. And for so many of our families who are paid hourly, it's not just missed productivity, but it's actually meaning less like dollars out of their paycheck that otherwise they would have gone by needing to pick their child up from school and trying to get them to a doctor. That's the hard data. And Superintendent Reyes, I don't know if you have any qualitative kind of feedback to add color to that from the family side.
Absolutely. I think that the thing I want to say first, Josh, is that you use the word equity a couple of times. And I just want to underscore that because that is what we live and breathe in Robla. We serve a very diverse student population. We're about 60% Latino and then about 15% Black, 15% Asian, 15% Caucasian. And we have to talk about equity a great deal because it's so much a part of what's happening in this community and obviously in communities throughout our country, making sure that our families have the faith to get what they need, right? And by providing the medical service through the school, and if we've done our job, and I'm proud to say that there's a lot of evidence that in Robla, we have done the job of creating strong relationships with our families, the trust is there. And so we've all heard about the distrust that can exist for communities of color with different fields, including medicine. And I think that if the school has a level of trust with the family, that's going to sometimes have a family feel confident enough to say, okay, I might be hesitant to go to the doctor over here, but if the school's partnering on this, maybe that's something that I am willing to trust. And so I think the fact that we're seeing that high engagement for our Black communities, for example, and that's something that's a really important aspect of this work. I would say that, yes, there are tons of stories about the kinds of things that have happened with our families. And I'd love to hear stories from our nurse where she, talked with families about their particular situation. But one of my favorite stories was about a child who had some ongoing health issues. And the child in their own head had come to the conclusion that when his parents had to take off of work in order to take him to the doctor for his problems, that was causing his parents a lot of stress. So he had taken it upon himself to kind of sometimes mask his symptoms because he didn't want to cause problems for his parents. And that whole situation completely changed when he could talk to a doctor at school, because now his parents didn't have to take off work. Now his parents didn't have to have the stress of finding a doctor for him to go to. And he was more honest then about what was happening with his own health. And she felt like it was an incredible, impactful situation for him to really get what he needed. So there's stories like that throughout the district over the years, that this type of access for the children and their families is so impactful, especially in a high poverty community such as this.
Fantastic, and that's that story. I'll share one other piece of data as we get close to wrapping up. And so one of the big metrics in the education world that's been looked at the last few years is this metric called chronic absenteeism. It's typically defined as kids that are missing more than 10% of the school year. And there's been a lot of data to show that it's one of the best predictors of reading level at third grade, for example. One of the best predictors is your actual attendance rate in kindergarten. And even if it gets better in first and second grade, if you're chronically absent in kindergarten, you're much less likely to read at grade level by third grade. And similarly at high school, your odds of graduating are 6 times lower if you have a year where you're chronically absent. And so it's a metric that most states have been looking at for districts. And what you see on this is actually from the California dashboard, Robla's percentages in 2016, 2017, 2017, and 18. And unfortunately, as a state and as a country, these numbers are getting worse. So if you see that dotted line, that's where the trend has been going. And what we launched Hazel in 2017, 2018 with the Robla School District. And what we found is where there was about a 14% decrease for a relative decrease for the Robla School District. Statewide, there was a 10% increase. And so not only an improvement, but bucking the trend. I want to stress this was not all Hazel and Robla's, but there's a ton of great things that Robla was doing to help address this, but we're really proud to be part of the good work that Superintendent Reyes and his team were doing.
Can I just add to that for a second, and Josh, and say, yes, I thank you for recognizing that there were a number of things that were put in place, I think, to make that impactful. But I guess I just want to underscore that idea that, I began my story today by saying that education can make a difference, but the education, you have to be present for it. And if you're missing school, then it's not going to give you the access that education can give you if you're missing school. So that slide, I think, is just so significant, because if children are in school, that's when school works. And as a side note, I will remind everyone, I know this is an audience, an international audience, but in California, schools are paid only when a child is in school. So it's not even that they're just enrolled, they actually have to be present for that day for you to get funding for that child for that day. So this is also how school districts are able to keep their lights on, by having children in their seats. And by keeping them in school, not only are we doing what's right for the child, but we're keeping the school district running. And that's a critical aspect of this work.
And as Superintendent Reyes, maybe for the last word. So there's so many other things beyond what Hazel does that I think could be done for kids and in partnership with schools. And would love for you to share with the audience. I remember how big of a deal it was when we stopped being talked about as a vendor and as a partner. And so if you think other folks in the room thinking about ways that they could support places like Robla, what would be your recommendation for other folks that are excited about this work?
Well, you and I've talked a lot about this over the years, Josh. I think that a partner who is willing to come in and listen, I think, is a really key aspect to having a successful partnership. School districts all have their own culture. We as a small school district have a culture that can sometimes be a little bit quirky in terms of how we do things. Hazel was willing to come in and really listen. And I remember at one of our very initial meetings, Hazel said to us, we want you to understand, there isn't, the way that we come to do this with you doesn't mean that there's a Hazel way that you have to adapt to. We are willing to work with you to come up with a Robla way of implementing telemedicine. And I will tell you that this change of attitude with our school nurse, who was one of the most skeptical people in the beginning and who became one of the biggest fans in the end, I think it was all based upon that. She had a lot of experience and a lot of insight about what works with our families, and a partner that came in and was willing to listen to the lessons that we have learned about how to be successful with our families is a really key piece. So, you can all maybe put that all under the umbrella of flexibility, but I think a partnership where everybody is trying to listen to each other, I think is really one of the most important keys to success.
Fantastic. And to Superintendent Reyes, thank you again for joining me. Thank you everyone for listening, and we hope everyone has a wonderful day.